Creutzfeldt-Jakob disease. Causes of Creutzfeldt-Jakob disease. There are 4 different types of CJD: sporadic, inherited, iatrogenic, and variant. Sporadic or classical is caused by the random misfolding of a protein. Inherited can be through the inheritance of a certain type of gene. Iatrogenic means the disease is acquired through a medical procedure such as contamination from brain surgery. Variant is acquired from eating beef tainted with bovine spongiform encephalopathy, also known as mad cow disease. These infectious forms of protein contain the same sequence of amino acids or the building blocks of protein. These prions can spontaneously change due to mutations within the protein. All mutations are considered dominant traits. These are thus passed on when the prion is replicated. If the prion gene is altered in a person's sperm or egg cell, the mutation can be transmitted to the person's offspring. Diagnosis. Diagnosis of this disease is mostly focused on eliminating other diseases that the patient could possibly have. This can be done by using a spinal tap to rule out more common causes of dementia and an electroencephalogram to record the brain's electrical pattern. This is particularly helpful because it shows a specific type of abnormality in CJD. Computerized tomography of the brain can help rule out the possibility of stroke or a brain tumor. The only way to confirm diagnosis of CJD is by brain biopsy or autopsy. In a brain biopsy, a neurosurgeon removes a small piece of tissue from the patient's brain so that it can be examined by a neuropathologist. This is a picture of a patient with the disease, which is considerably holy or spongy. Signs and symptoms. As the disease progresses, symptoms tend to get worse. Early symptoms for CJD can include mood swings, depression, anxiety, memory loss, social withdrawal, insomnia, and clumsiness or lack of coordination. These symptoms are clumsiness and insomnia. These symptoms are not as pronounced as shown in patients who have progressed with the disease. Later symptoms include visual deterioration, dementia, involuntary muscle contractions, muscle paralysis, slurred speech, difficulty swallowing, and coma. A majority of patients will die within 1 year of diagnosis. Treatment. Unfortunately, there is no known treatment to cure or control CJD. Researchers have tested many drugs, including steroids and antibiotics. Studies of a variety of other drugs are now in progress. However, so far none of these treatments has shown any consistent benefit in humans. Preventive manners. There is no known set way to prevent sporadic CJD. To prevent VCJD, avoid eating beef produced in areas that might have BSE or mad cow disease. Destruction of surgical equipment used on brain or nervous system of patients with CJD can prevent iatrogenic spread of the disease. Prognosis. In earlier stages, as said before, there can be failing memory, behavioral changes, and lack of coordination. As the disease progresses, symptoms can become more pronounced and will end in fatality. Unfortunately, around 90% of patients will die within a year. Incidence and statistics. Before controls on high-risk offal were introduced in 1989, between 460,000 and 482,000 BSE infected animals had entered the human food chain. This caused there to be a higher rate of fatality during these times. The average age of death of CJD patients in the United States is 68. About 1 in 1 million people will develop the disease, and 272 per year, 22 per month, or 5 per week will die of this disease. This graph depicts the number of deaths per each year from this disease. Location. In the last 5 years, the United States has reported between 279 and 352 cases a year. The United Kingdom was most affected by VCJD. This map depicts the mad cow disease in Europe. Once France had found this disease in their food, other countries were reluctant to buy beef from them. History. H. G. Creutzfeldt was credited with the first description of the disorder in 1920. A German neurologist, A. Jacob, described 4 cases, 2 of which had similar symptoms to what we describe CJD as today.